Good evening, everyone. My name is Rudi Pageis, and welcome to What Your Community Pharmacies Can Do for You. And in fact, your community pharmacist is a trained medical professional who provides a range of services which are easy for you to access, as their services are often in high street shops and in your neighborhood. And you can just walk straight in and get the information, advice, guidance, and support that you need. So I'm pleased to welcome Michael and Kunle this evening.
Thank
Good
you.
evening, guys.
Oh, good evening. Good evening.
Good
Good
evening.
evening, Rudy.
Hi, Kunle. Hi, Michael. And I know you're very busy, so thank you very much for coming onto this platform in terms of for Southeast London. So we're very much talking about Southeast London communities and neighbourhoods. So Kunle, can you just tell us a bit about yourself, how you became a pharmacist? And as I mentioned earlier on, many people don't realise that a pharmacist, you are actually in fact a scientist.
Oh, that's quite funny. Uh, I I started my first degree was actually in pharmacology from University of Lagos in Nigeria. Then came here, then studied pharmacy at the University of London here at Brunswick Square. Graduated 1998. Uh, After which I actually did my peerage. Actually, in 1997 I graduated, then did my peerage in 1998 at Buddha Chemist, where I actually worked for many years until the year 2000, when I then was privileged to actually bought over a community pharmacy somewhere in southwest uh, London, near Croydon precisely. And I've been there for the last 20, 21 years thereabouts,
Mm.
where we provide pharmaceutical service for a wide range of people, from elderly to youngsters to pregnant women, and so we have a wide range of clientele and patients, and we're as a matter of fact, where we're located is actually so central on a major road, uh, that boundary between Wallington, Sutton, and then Croydon. So
Okay.
it's been quite a good experience over the last 21 years.
Yes. Great. Okay. Thanks for that. And Michael.
Oh, hello. Good evening.
Evening.
Well, I qualified in Ghana and then came over here and did my YouTuber course. I worked with colleagues of mine for some time, and I bought my own pharmacies. Two of them, one in Belvedere Pharmacy, which is close to Belvedere Station, and Southeast London, or Bexley precisely. And my other pharmacy too is in Kidbrooke, which
Okay.
is a pharmacy,
Is that
and it's also
Lewisham? That's in Lewisham, isn't it?
it's in Greenwich, yeah,
In
Greenwich.
Greenwich.
It's Greenwich, yeah,
Yeah.
yeah. So
Okay.
these are the two pharmacies. But currently, I mean, we are serving in Belvedere. We do a lot of things. Um, at the moment, what cake is the COVID vaccination that we are doing currently at Belvedere Pharmacy.
Thanks for that. So, um, Kunle, so why have community pharmacy been so accessible and during this lockdown over the last year? And so what is it about the local community pharmacy and accessibility when it comes to the neighbourhoods and the families, and those local communities from all backgrounds?
I think because community pharmacies amongst the health professionals are more accessible to
Mm.
the local community, and they're also experts in medical science. Uh,
Right.
Apart from the actual diagnosis, community pharmacy can actually counter prescribe, and they can actually treat majority of a lot of the ailments and uh, s- simple issues that people actually have in regards to their health. So we're actually well placed to be able to meet those basic needs. If you can recollect, over the period of the pandemic, for example, most of the surgeries were actually closed. So we were actually the ones actually championing the health service over those periods. Apart from major emergency services like the 111 and the rest of it, we were quite central in actually meeting the needs of our communities.
Right, thanks for that. So building on that, then, Michael, are there
Hello.
any costs? Are there any costs at all for the public to seek this type of advice that Kunle spoke about?
No, I mean the cost. There isn't any cost implication. I mean, not like you make an appointment to see your lawyer or make an appointment whereby you have to pay. We don't do that. We use working straight. And as Kunle was saying, there's a host of service that we provide. Do the minor ailments. We do substance misuse. We do what we call emergency supply of medication. There's a new service coming called the GP CPCS, whereby GPs will be referring patients to the community pharmacy to offload the pressure on them.
Okay.
There are so many things that we do. A PCR test at the moment, most pharmacists are doing. Promo vaccinations, we do phlebotomy, needle exchange. So there's a host of things that we do. And then the magic bullet is that you just walk in straight, and we are there to just at the spread to help you. So that's the beauty of community pharmacy, whereby the community that we serve are at liberty to walk in, and then we offer our services. One thing that people have to understand is that we study almost the same subjects before we divert to either do medicine or pharmacy. So when it comes to A levels, you are studying either the biologies, the chemistries, the maths, and all that. These are the basic things. Even in university, you get most of these things, which are pharmacology, medicinal chemistry. Most of these are studied. So that gives us all the necessary knowledge to be able to diagnose certain things in a simple way, not like doctors, but more especially we are the experts of medication, and therefore we are able to provide as much as possible the needed information when it comes to medication. And all this.
Thanks for that. And my next question for the both of you to give your perspective on this, as it relates to the vaccine. So what are the side effects of the vaccine, specifically around public concern, as it relates to blood clotting risks? So I'm sure we would be interested to get your individual perspectives on the experience.
I think the way people have actually looked at it is blood clot is not something that is new, and it's not solely related to COVID-19 vaccines. It's something that an average person out there, could actually get. It's just about hypercoagulation of their blood. So it can actually happen to anyone. Yes, some individuals are actually predisposed to actually having it after the jab, but it's not a general issue that people need to worry about. And even if they do have it, it's something that are treatable. It's not something that is life-threatening, that can actually, lead people to either being hospitalized or premature death. So I wouldn't, in all honesty, I wouldn't want people to use that as a basis of not actually taking the vaccines.
Yes. Okay. Thanks for that.
To add to it, what to say, every medication has got a side effect. Every medication has got a side effect. And one major thing about that's going on with especially AstraZeneca vaccine is the notion that's gone out there that it causes blood clots. Now, the unfortunate thing is that the portrayal of that information is a bit counterproductive, in the sense that if that side effect was, mentioned with respect to someone going on a flight, with respect to someone taking the pill, with respect to someone having a major surgery, you do realize that that side effect of black clot is very, very negligible. I believe that this is the sort of information that the media needs to help portray, because when it comes to the information on social media, it just says, oh, it causes black clot. I mean, we've had several people coming in for their vaccination. Oh, no, I've heard that AstraZeneca causes black clot. And when you tell them, are you going on holiday? Yeah, I'm going on holiday. You know that the risk of going on a flight is even of getting black clot whilst you're on a flight is far more than having the AstraZeneca. Then they take a step back. They don't realize. So I think if education needs to be had, so that people will get to know that sort of blindness statement made that it causes black clot is not very helpful, and that it's a very, very, very negligible number who gets that, and that should not deter people from coming forward to get their vaccination.
Okay, thanks for that. So, can you talk us through in terms of people who may want to get the vaccine and they come into your location? So what is the process now? How will it work?
Well, the current process now is probably depending on where they're at. The first process will probably be for them to go to the NHS website to actually look for a local vaccine center. Currently now, a lot of pharmacies are actually providing vaccination. So it's something that they can actually find out either from their local pharmacies, whether there's any pharmacy around them, or a vaccination center. And it can easily be booked online now, and the government has made it so easy for anybody out there from the age of 18 upward. They can actually book it quite easily from the website or from local pharmacies. And all they need is just their name, their date of birth, their NHS number, and easily they can actually book their first dose. And probably subsequently, after about 8 weeks afterwards, they can actually book for the second dose, which can actually be done 24 hours after the first dose. So it's been made so easy for anyone out there who is actually willing to take on the vaccine. Yes,
yeah.
So it made so easy.
Okay, so your local pharmacy can be a referral point as well, though. And of course, people don't need to have an NHS number.
No.
And that's an important thing for people to realise. And of course, whether they're not sure about their status or not, nobody's going to ask them about their immigration status or anything of that kind. So they're entitled to that. The Windrush generation and many other sort of people. Yes.
If I may come in, if I may come in, because I'm offering the vaccination in Belvedere.
Yeah.
What's happening now is that thank God, Besley Council, for instance, has made it easy for people to come in. So now we offer walk-in service for most people. So as Kunle said, the first point of call is to book your vaccination online. But whenever we got spares, we are able to offer it freely to people who walk in. But sometimes people find it easy. A bit easy to walk in and get their vaccines done. So that's one thing. Now, gone are the days when people were scared to come in. We're not sure whether people without an NHS number or without a GP can be that. But now the system is so flexible. Anybody can walk in so long as you are 18 years and above. And even now, with the Pfizer, is going to be reduced to 16 or above. So, so now anybody can come in. There is no sort of hindrance for anybody to do that because of this or because of technicalities. If you call Belvedere Pharmacy, for instance, unless I'm constrained with vaccine, but now, thank God, the supply is getting very, very fluid now. So if you call in, we can offer you that easily. So that's one thing that I will urge people. And it's not only Belvedere Pharmacy. Most pharmacies are offering such a walk-in now. So there shouldn't, Yes, there are some people who have got issues with, like computer booking and all that. But what we're saying now is, please pick up the phone, call your local pharmacy. Most local pharmacists are doing that. Call them, and you'll be sorted.
Also, they can actually also call 119
Yes.
if they're not quite sure, and that's free um, from their phone.
Right. Okay. Okay. So many people still are concerned in terms of what actually goes on in the vaccination clinic itself. So what is the process again on entry?
Well, I don't offer vaccination, COVID vaccination at my premises here. I think probably Michael might be a
Yeah.
better person to actually respond to that.
Yeah. So let's walk us through the process on arrival, Mike.
That's fine. So obviously we got what we call stewards who welcome you, and basic questions that we check. I mean, elsewhere we can check your temperature just to make sure that you haven't got a very high temperature, because sometimes some people are not well, and because they think that it's a vaccine which is going to cure them, but it's not a vaccine which is going to cure them when they're not well. So because sometimes too you can get sort of side effects like temperature, headache, nausea, dizziness, tiredness. With that, we want to make sure that you are perfectly okay. If you have certain minor issues, that doesn't prevent you from having the vaccination. So when you come in, certain basic questions we ask: have you had any vaccination in the past 7 days? Are you feeling okay now? If you say yes, I mean we can check your temperature for us. If you're not, we can check for you. We ask whether if you're a woman, whether you are pregnant or not, because obviously depending upon whether you are pregnant or not, we can offer certain vaccines and not, and not the other. So these are basic questions we ask you, and then it's a matter of once you go to appointment, you come in, where you see the clinician, we sit down, verify your details. And I said, where you live, your date of birth, and all that. If you haven't got any GP, if you haven't got any NHS number, we're able to fill that bit. No, it's not an issue. And then we just go through the vaccine process. We tell you what the side effects profile, whatever you're going to, you're likely to experience. Ask for your consent, and once you're happy, ask for which arm you want to go for, and we get the vaccine done, and then we make sure that the information is sent to the national database. So when you call NHS 119, or if we go to a GP later or whatever, all the information is going to be on your NHS record. So that's how it works now. And then for certain vaccines like Moderna and Pfizer, because they are so similar, we ask you to wait for 15 minutes for observation. For those who are coming for AstraZeneca, you don't have to wait. After the jab, you can go away. But some people also, I mean, because of certain experience they've had, might ask you that, oh, is it okay if I stick around for a few minutes just for you to observe? And we are happy to do that. Yeah, so those are the basic distinction. But otherwise, it's a very, very smooth process.
Yeah,
Very, very smooth.
Yeah, that's great piece of information. And so, what happens if somebody did experience some side effects? Whilst they're there.
I think
Yeah.
the side effects are quite minor. When I remember when myself and six of our staff actually went to have a vaccine, we all reacted differently. Myself, my wife didn't react as much, but two of my staff had achy hands. Some said they felt a bit feverish, but this only subsided within a day. So
Right.
the side effects after the COVID vaccination, they're so minor that no, people shouldn't actually use that as a deterrent
No.
from not taking it. I wouldn't want anybody to worry about that.
Right. Okay. And
Even
Michael?
even if the normal flu vaccination, people
Yes,
do
of
have it.
course.
Exactly. So
Yeah.
it's not any different actually.
Right. From my perspective, and from the experience I've had so far with the vaccination, I do realize that it's the anxiety that people have. Or how many young men have dreamt of going for a needle, jab? No, it's all because of COVID. So
Yeah.
some people, before they come in for the vaccination, are so worked up, so anxious, and it's the anxiety to me which makes things worse for them. You see, so you realize that, I mean, I've had a station where even there's a client, I mean, someone coming for the vaccine, as soon as I start the person nearly collapsed. I mean, nearly collapsed. You know, the need that person. So it's the working approach. I mean, there are other situations whereby, yes, genuinely someone might have the job, and while it's being observed, might feel a bit easy. So the advice that we normally give to those who come for the vaccine is that especially with the Moderna and Pfizer, when you come for it, we advise you that if for any reason you feel dizzy or lightheaded while sitting there for the 15 minutes, you just call us. All that you have to do is you lie down, raise your legs up. You are, within a couple of minutes, you're perfectly cool. All that is what it does is that sometimes you have the drop of the blood pressure, and therefore lying down and raising your legs up brings the blood pressure back. You are perfectly fine. So these are the things that you can experience whilst you are waiting. Then the post, when you leave, obviously, as we said, a bit of pain around the site of injection, a bit of temperature, a bit of nausea, a bit of headache. These are all possibilities. One thing that we need to let people know is that when someone brings on a social media that, oh, I had a job, I had a dead arm, I had a job, I couldn't get that for 5 days, and the person thinks that he or she is going to go through that, that is not the case. We are all different. Much as the fingers are never equal, we are all different. And therefore, the experience that one person goes through does not mean that you are going to go through that. And please, so people should not put themselves in another person's shoe and think that they're going to go through that, and that should deter them from coming forward. You will be perfectly fine. And even if you do experience such side effect, it's just a few minutes and you are sorted.
Yeah. Okay.
And plus, we also advise that if the pain is a bit too much for you, for instance, you can go for painkillers like paracetamol, ibuprofen, or something, to keep it going. So that should not prevent you from doing what you have to do. You can do whatever you want to do.
What I normally recommend for people to do, I did with my staff, is even half an hour before the injection, take, probably 2 paracetamol before going. That would actually reduce the incident of the pain, even the ache you have in your arm, and headache as well. So if people can take simple precautions like that, a lot of the things that, even a lot of the side effects that I've even written, even online, they may not even have it.
Okay.
Yeah. Sorry to bargain. It's just that bit that sometimes I have a bit of issues with us. The advice that we sometimes give is that when you take the vaccine and you start feeling a bit of know yourself, that tells you that the vaccine is working. Your body, the body is responding. Yeah. So I, for one, to be honest with you, I have to be honest and say we advise that place, if it's possible, not to take any medication. Not to take it to counter it. Because I say you could be perfectly okay, but you can have the medication, the painkiller with you. But when it starts feeling that, they can go for it as and when it's needed. You see, but otherwise, what I realize that most people keep on taking it, thinking that that's gonna. But we want people to know that yes, the body is reacting well to it, and we feel okay with it. And most people are perfectly cool. Most people are perfectly okay to go on without taking any medication. So. From our experience, that's why we've been telling people. But I know that, yes, there are people who have come in and who have taken a couple of paracetamol because they've been asked to take that. But I say that maybe you might not need that because you might be perfectly okay. Yeah.
Well, people should come to you for advice, right? As we're coming down, there's quite an extensive list that, and I'm going to ask you both just to make some comments on. In terms of, you give advice on how to look after yourself in terms of wellness. You review medicines to make sure that, people are getting the best of their medicines. And again, anybody with new medicines and some of the issues that they may be facing, some of the things you do in terms of alternatives. Of course, there's the flu jab and the booster jab to come, emergency contraception and stop smoking service. So that's quite an extensive range of services that you're providing in the neighborhoods and to your local communities. So I just wondered whether you wanted to just follow up on some of those items.
I think even what we do is even more extensive than that.
Yeah.
That's probably an abridged form of what we do. You
Yeah.
have to list what the pharmacists do on a day-to-day basis, on a weekly basis. There's
Mm.
far, far more.
Yeah.
I mean, sometimes we sometimes even provide services for nursing homes.
Okay.
We for elderlies who have dexterity issues, we
Mm.
actually provide monitor dosage systems for them to help
Mm.
them actually administer some of their medicines. Some of them with cognitive issues, we also help them. So what we do at the pharmacy, as well, the lists are endless.
Mm.
Yes, we provide emergency contraception, we services, we provide non-smoking, we
Mm.
provide counter prescribing, uh, we provide homeopathic products just to help with people who probably
Mm.
are probably a bit wary of orthodox medicines. So
Yeah.
the lists are endless. So
Okay.
it all depends on the community that you serve and the major need that they have that you need to support them in.
Yes. So, Michael, have you got anything to add to that?
Yeah, of course. As Kunle said, yeah. I mean, at the moment, community pharmacy is more or less most community are becoming like a one-stop place,
Mm.
depending upon the clientele that if you service or the community that you see service. I think one major hot cake at the moment, which is caught on is the minor ailment scheme. There was that scheme in some boroughs whereby people can come in, tell you their issues, and we offer them offer them medication sometimes for free, and those who pay for the medication they pay for it. Now that service is you can call NHS 111, for instance, and that service is there. There is also what we call, as you mentioned, emergency supply, medication supply, whereby people who are taking their regular medication, say the person might have requested for his or her medication, and maybe it wasn't available. It's a weekend, Sunday, or I mean Saturday, late Saturday. The person hasn't got any medication. That's what we call the emergency service, whereby you can call NHS 111. A referral can be sent to the pharmacy, and the pharmacy, now having access to what we call the summary care record of the patient, can actually check and find out what medication the patient is really taking, to be sure that yes, you are supposed to be having this. I mean, now you can travel to, for instance, Manchester, for instance. You might have for forgetting about medication, but now with the way many things have been set up in the NHS, you can go to any pharmacy, and once they refer, I mean, once a referral is sent to that pharmacy, you can be seen to and make sure that you don't panic, or you get your medication and you're sorted. As we're saying, we do the flu jabs, which is gonna come soon. We are doing the COVID jab, which is ongoing. Substance misuse. I said we've got a lot of people who have unfortunately addiction. So there's that option there to help them, you know, gradually get off that sort of addiction. So that we've got a system whereby we give them medication to substitute what they're taking, so that gradually they can come off that. That's there. There were a lot of surveys that were done under NHS, which is a bit now not available, like smoking cessation, but we can do that privately as well. So it doesn't mean that if you really want to quit, it doesn't mean that because it's not more offered under the NHS. No, really, you can come anytime and we can get it done. Now with the travel season on, most people are going. I mean, can get their what we call the PCR test, to aid them to get their certification before they travel. So these are there. There are so many things which are going on in the pharmacy that things have changed. Things have really improved, and with the span of technology that is there now, there's a lot that we can do. I said it's not everything that every pharmacy is doing, but there are so many things that's going on. So it's a matter of just picking the phone call to your pharmacy, and I'm sure you'll be sorted.
Great. So that's great information. And so we've come to the end of this particular show. We will be back again soon. Thank you very much, both Kunle and Michael. And they really have told us today what your community pharmacists can do for you. Thank you and good night all.
Thank you very much.